As I shared last night, I'm quite inspired to be here. I'm here only by association. You know, I haven't earned this honor to be before you, but I feel truly privileged and honored that I can say I'm Terry Fox's brother and Raleigh Fox's son. So I appreciate this opportunity. I want to echo what Casey said earlier in terms of the presentations this morning, those from researchers and doctors. In light of my role and past role with the Foundation and recent role now with TFRI, I'll use acronyms a lot. That's the Terry Fox Research Institute. I sit in on research meetings quite regularly, and I usually nod off at 9:12 a.m. But because of the impressive people this morning, I really enjoyed hearing from you all. And I think what I recognized, and maybe you all recognize this as well, was the passion. You cannot teach passion. It comes from within, and that's what I recognized with the people that we heard from this morning. Well, I think you're all familiar with the Terry Fox Foundation and the progress that has been made in terms of raising money for cancer research, but you may be less familiar with TFRI, which is the Terry Fox Research Institute. So I had no idea what it is either, but no. I would like to share a few slides on this. So I basically have two pieces of this presentation, the boring presentation and then the very boring presentation. So, but what I want to do is talk a little bit about TFRI, the research that the Terry Fox Foundation supports, and then share my personal story about my dad. TFRI. So why did Terry run across the country in 1980? He ran across the country because he believed there needed to be more dollars for research. When Terry was diagnosed on March 3rd, 1977, and he was told he had cancer, he had never heard of the word before. That was his first association with the disease. And instead of, like we do today, finding Google or the internet, Terry went to the library. He was a student at Simon Fraser University, and what surprised him was the lack of support for cancer research here in Canada. So he wanted to do something to change that, and hence his idea and his dream of running across the country to raise money for cancer research. So as was suggested earlier, I was part of that Marathon of Hope. I was 17 at the time, I'm now 24. 25, 26. So I spent 3 months in a stinky Ford van back in 1980, and I witnessed a miracle. I did. I witnessed my brother run almost 42 kilometers every day on artificial leg. So he showed me that limitations are self-imposed, that anything is possible if you try. I have to update the figure. It's actually more than 600. It is over $700 million that has been raised for cancer research over the last 36 years. And I think Terry has inspired Canadians to focus on cancer research. So we created TFRI in 2007. And the reason why is we had a pretty successful 25th anniversary in 2005, where, well, pretty successful, very successful. We doubled revenue, we raised over $50 million for cancer research. So it was a fairly good year. And as we've always done, we've always gone to the research community. Whenever we've had a surplus of funds, we go to researchers from across the country, and that's what we did in shortly after 2005. We brought them together. We had a 2-day meetings where we asked them, what would you do if you had $50 million available? That included the surplus from 2005, plus the fact that we had felt we had reached a new ceiling going forward. And they came forward with two ideas. One was they felt that we could create our own institute. Prior to that, we allocated funds to the NCIC. We cut a check, the National Cancer Institute of Canada. We cut a check every year to the NCIC. And two, they felt that we should focus on translational research. They saw that as a national gap that needed to be fulfilled. Now we have, for the most part, for the last 3 decades, we focused on discovery research. So lab-based research, but the gap was taking that research and getting it to the bedside. And that's where the research committee felt we could fill that gap. So, with the promise of 50 million in research dollars, TFRI was created. 2 years later, the National Cancer Institute of Canada dissolved, So TFRI took over responsibility for the programs that the NCIC was administering. Currently now, TFRI manages over $30 million in Darrell Fox Foundation monies that are allocated every year to cancer research programs across the country. TFRI strives to be an outstanding cancer research organization by supporting only research excellence. That was Terry's focus in 1980. He wanted to fund the very best, and that's what we continue to do 36 years later. And he believed in collaboration and team science. You know, remember back to 1980, what did Terry ask for? He asked for $1 from every Canadian. He wanted it to be inclusive. He wanted everyone to be part of the Marathon of Hope, and that's our focus as well. We want to bring people together to try and improve outcomes for cancer. And we tend to build that collaborative culture by working with partners across the country, and the next slide will illustrate that. And we also have international runs. My sister Judy, actually, she's got the wonderful job of being the international run director. She's younger than me. I don't know how she got that. I have to figure that one out. So she gets to visit wonderful locations like Cuba and Dubai and Taiwan and to see the impact of Darrell Fox in those countries as well. So TFRI is a virtual institute. So we do have a head office in Vancouver, BC, the wet coast, the very wet coast, I must remind you. But we have nodes, 6 nodes across the country. So we have a BC node, an Alberta node, a Prairie node, Ontario, of course, Quebec, and the Atlantic region as well. And we have leaders at each of those nodes that form our executive committee. And you can see the list of the various research organizations, institute, universities that have signed MOUs with TFRI and have agreed to work together on pan-Canadian projects that we support. So these are basically the 6 programs that we fund, and you can see this not showing up at the bottom, but this should total the 30 million that I referenced earlier. Again, you can see the emphasis on team science. The first 2 programs are team-based programs, and that total approaches $23 million. The program project grants, acronym PPGs, have been along since the early 80s, and they require 3 PIs, principal investigators, working together, and they're primarily at the same institution, but it is bringing people together to work on a common issue and to try and answer a particular question. The translational research programs are what was responsible for the initial creation of TFRI, and they're more milestone-driven, business case developed, and they are pan-Canadian. So it's not just at one particular institution in a city and or province. They have to be pan-Canadian. They have to also have sites across the country. I don't have time to get into Comprehensive Cancer Center Network right now, but I think it would address some of the questions, or the question Heather asked earlier today in terms of variances in treatment from different provinces. We want to try and solve that particular issue. New investigator awards. It used to be the Young Investigator Award, but you can't use that term because they're not young. But they are new in that they want to establish their own lab. I think, yes, okay. And what we are hoping that they will do, and what has to be part of that award, is that they are affiliated with one of the team programs that are referenced up above. And then we also have a little bit of money that goes towards training programs as well. These are strictly the translational programs that we're currently funding. And the reason why I wanted to share this slide is because of number 9. The early lung cancer detection study, which we have funded since that was the first TFRI translational project that we supported. Dr. Lamb is based out of the BC Cancer Agency in BC, in Vancouver. So he's a lead, but there are sites across the country. But these are some of the other, you can see some of the other cancer sites that we are supporting and funding. So, I mean, again, Terry, I thought, had incredible vision. He could have ran across the country to support bone cancer, osteosarcoma only, which is a very rare form of cancer, as we all know. but he wanted to help all diagnosed with cancer. So that's always been our vision. We've heard this, and I've become more aware of this, obviously, because of my personal experience earlier this year. But we know, and I know now, that lung cancer detected early enough is curable with routine surgery. I think the US study was referenced earlier today, how low-dose CT screening of heavy smokers or former heavy smokers decreases lung cancer mortality by 20%. That is huge, significant. So Dr. Lam and his team came up with his innovation of being a web-based questionnaire that asks simple questions with respect to addressing questions towards former and current smokers. And this helps identify those at risk and also helps to reduce costs. So here's some of the results based on the early lung cancer detection study. Illustrates the risk of 4.5%, which is the average risk based on a number of factors. How long you smoked, how much you smoked a day. So that's 4.5% across the country. But what I find interesting is the number of, over the 5.5 years that this study was taking place, 164 cancers were detected early and lives were saved because of that. Significant. So this slide shows the implications of the stage shift. So looking at screening versus non-screening. Non-screening, obviously that this figure was referenced before, 48% are diagnosed with stage 4. With screening, that 48% is reduced to 8%, and 70% are diagnosed stage 1. That's where we have to get to. Oh, this picture, interesting. Maybe I only know the details of this particular picture, but this was taken outside, actually. This was taken on University Avenue. Terry's running down University Avenue towards Nathan Phillips Square. I think it's appropriate to have this photo here. I'm not in the shot because I'm way ahead of Terry at this time. I wish, but in the back you can see my older, uglier brother, Fred. He's on the right-hand side, and Darrell Sittler is right behind Terry as well. That's my dad. Roland Murray Fox, pretty guy. My dad, Terry Fox's dad. I am all too familiar with the numbers. Over 200,000 Canadians will be diagnosed with cancer this year. Close to 80,000 will die. Over 20,000 specifically from lung cancer. Dad became one of each of those numbers earlier this year. He was diagnosed in early January, he would die, and he had lung cancer. He died on March 8th, a little more than 2 months after being diagnosed. Strangely enough, March 8th is a day 39 years earlier that Terry had his surgery to remove his right leg due to osteosarcoma. Roland Murray Fox, or Raleigh, would fit into the 35% of those diagnosed with lung cancer who were former smokers. Fred, Darrell, myself, and Judy, the 4 children of Raleigh and Betty Fox, grew up in a smoke-filled environment. It was a time when smoking was accepted. Dad and Mom smoked, all their siblings and friends smoked. Our grandparents smoked more. The house, the car, most interior spaces we found ourselves in contained carcinogens. Our escape was our collective passion for sport, either indoors in gyms playing basketball and floor hockey, or outside on soccer and baseball fields, or running track or cross country. Dad started smoking at the age of 19 and would maintain the addiction for 32 years. Mom would quit the day Terry was diagnosed with osteosarcoma on March 3rd, 1977. Dad would continue to hold tightly to the habit for 9 more years, which made for some interesting Terry experiences. Throughout the 80s, when Mom and Dad would attend events that acknowledged Terry's legacy, Dad would need a device. He would need to devise a plan so he could escape from the formal activities for a much-needed puff. It would take a simple dare from an old brother for Dad to quit, cold turkey, on May 24th, 1986. Never tell a fox you cannot do something. Inspired by Terry, he would then start to run, setting a goal of running 10 miles within a year. Exactly a year later, he would fulfill that goal and run 10 miles. He would quit cold turkey and never run again. He would also never smoke again. On May 24th this year, it would have been 30 years since his last cigarette. I have lived in the cancer world for over 3 decades, but realized from Dad's lung cancer diagnosis, my experience was mostly on the peripheral. On March 3rd, 1977, we were gathered in a private room at Royal Columbian Hospital in New Westminster. It was the night Terry was told he had osteosarcoma. He was expecting, perhaps more hoping, to hear he had a knee ligament problem related to his fetish for basketball. Terry was initially devastated by the news that he had bone cancer and his leg would have to be amputated 6 inches above the knees 5 days later. But then he surveyed the room and recognized his family was not coping well with this cancer diagnosis. We were all in tears, asking the usual questions that started with the word why. Terry, at the youthful age of 18, quickly realized and accepted he would need to be strong for us all. From that night forward, he saw cancer as just another challenge. He was also determined to protect his 2 brothers and sister from witnessing his pain and suffering. We never witnessed the impact of adriamycin and methotrexate. Terry would check himself into the BC Cancer Agency clinic for his chemo treatments and would only leave when he had fully recovered. With Dad, we took it all in. We attended every appointment, doctor's meeting, and radiation treatment over the 2-month period. We were impressed and touched by the compassionate people who came in contact with Dad. The 200,000 Canadians diagnosed each year with cancer became more than simple numbers to me. They were lives, each and every one of them connected to family and friends. I witnessed the interactions, the love, the hope. Yes, hope was there. Hope was everywhere. That hope was extended to Dad, and he embraced it. Dad was almost 81 and not in good health. He barely recovered from double pneumonia 2 years earlier after returning home from St. John's and the other side of the country, where a new statue of Terry was unveiled to mark the beginning of the Marathon of Hope. Despite his frail condition, he made a promise to Terry he would take lung cancer on and to never give up. He was tested for the EGFR mutation. As we heard earlier, if positive, Dad may have benefited from more targeted therapies. It was not, so traditional chemotherapy was the option for Dad's late-stage lung cancer. He also became aware and registered for the personalized oncogenomic program at the BC Cancer Agency. This is a highly experimental research program for cancer patients with metastatic cancer. The program is setting out to decode the human genome, the entire DNA inside the cell of an individual's patient's cancer, to help understand what might be enabling it to grow and to potentially develop treatment strategies to block its growth. The overarching goal is to use the information to direct patients towards targeted therapy, clinical trials, wherever possible. Dad had a unique sense of humor. He did. Now, would he allow me to do this? Of course he would. He would be happy if I did. In fact, I could spend the next hour just sharing pictures of my dad in this situation or similar situations. His memory was not the best, but regrettably, he always remembered his jokes. They were not politically correct, but Dad got a pass because of his age. He gave new meaning to the word repetitive. We cringed every time he started to deliver, and we dreamed of new material. I want to leave you with his last joke shared 3 days before he passed away. Now, at this point, Dad was resting very comfortably and spent much of his time sleeping. But he suddenly woke up, and after surveying the room, he said, "Wow, who are all these people?" We answered his query with, "It is your family, Dad. Your kids are all here, and all your grandkids are here." Dad paused, then straight-faced said, "Gee, you would think I was dying or something." That was my dad, just another individual touched by lung cancer. As I shared last night, I feel part of you, and I've enjoyed the interactions I've had and hearing more about this disease, and I'm personally interested in want to be part of your journey now. I agree with what Casey said. You know, we need to do something about the stigma that is lung cancer. And I'm prepared to help in any way that I can going forward. So my thanks to you all. Thank you.